Hello, and welcome to the Advanced Care Planning webinar for mental health community. You will learn about the importance of advanced care planning for mental health crises, as well as how to create your own free online medical advanced care plan. My name is Carrie Guthrie Cho, and I'm the President and CEO of Cornerstone Montgomery. Cornerstone Montgomery is a private nonprofit behavioral health provider in Montgomery County. We provide a wide range of services to people ages 13 and up in Montgomery County, Maryland. We have housing, outpatient mental health centers, employment services, case management, and crisis services. We serve over 2,500 people a year, and our mission is to help people with mental health and co-occurring substance use disorders with their recovery so they can be active members in the community. Next slide. What is advanced care planning? Advanced care planning is also called an advance directive or a living will, and it can address medical care and mental health care in a crisis situation. Advanced care planning is making choices about the care you want to receive if you are unable to speak for yourself. These decisions are based upon your personal values and preferences, as well as discussions with the people who matter most to you, including your personal support like family and friends, doctors, and providers. This means that in an emergency, the treatment providers will know what to do for you, even if you or your client cannot tell them. It's the guide for treatment in an emergency. Many of you have probably heard of advanced directives for medical issues, but you may not realize that you can also have an advanced care plan for mental health issues. Today, we're going to talk about advanced care plans and how you can include one that can be shared with all of your providers. Why is an advanced care plan important for the mental health community? It serves as a way to protect your autonomy and ability to self-direct care, so you can have a say in your care even when you can't speak for yourself. Those who matter most to you will not have to guess what kind of care you want. And those providers that you're working with will know your values and preferences and be able to be better advocates for you in a crisis situation. As you know, when someone is in a behavioral health crisis, because of increased symptoms, they often don't recognize that they are having trouble. They may not want to talk about treatment or hospitalization, but if there's already a plan in place that is written down with what they want, then no one needs to guess or force an intervention. The client or the patient has already done that in writing. Next slide. A mental health advance directive guides care when a person's attending physician and a second doctor certify that someone is incapable of making informed decisions about their mental health treatment, and they need to be placed in a hospital or another setting. There are several elements that a person can choose to include when creating a mental health advance directive. These include preferred hospitals and service providers, so you can say which hospitals you prefer. Please realize that if there isn't a bed available at that location, you may end up going to another facility, but at least they can see your preferences. You can also specify people to make health decisions and people with whom information can be shared. Basically, it's like having a permanent release of information so that providers know who they can share information with. You don't need to worry about that in an emergency. The advance directive tells them who they can and can't talk to. It also alerts them to allergies, adverse reactions, and other health and medication issues. Knowing if you are allergic to medications is key to ongoing treatment. You can even comment on the dosages of medication that you are comfortable with. And if you have received certain treatment and didn't respond well, you can let them know. Finally, it also talks about your desired visitors and other conveniences that might help you in your recovery. This allows you to let them know who can visit you. You can even talk about specifics, like if you like a certain kind of food, music, or if you need slippers or a blanket if you tend to get cold. If you're a smoker and you're going to need the patch or the pill to deal with that in the hospital, you can also let them know about that in this document. Whatever you can think of to make treatment as successful as possible. Next slide. The Mental Health Advance Directive also includes specific instructions about treatment. We've already talked about medications, but it also talks about different types of treatment interventions, such as ECT or TMS, and other treatment ideas. It's very important that you review this with your regular treatment provider so that you can make the best decision for you. Are you willing to participate in a research study is also a question that you'll find in here. Other things that are going on that might affect your mental illness. Do you have a substance use disorder? You want to let people know that if you are really depressed, you may have been drinking because that is often what happens. Do you have another medical condition such as diabetes or a thyroid condition that also may impact your mental health? All of this information will let the treatment team know if there are other things they need to look for. Having this plan can potentially avoid involuntary treatment because you have made it clear what you will do in a mental health emergency. Next slide. Research shows that the advantages of having a mental health advance directive really go a long way. It definitely shows there's a significant improvement in your working alliance with your clinicians because you've had this discussion, you've had a conversation about what really is going to work for you in a crisis. There are fewer coercive crisis interventions because things are already planned out. And there's better correspondence and collaboration between preferred and prescribed medications over time. Increased perception that people's personal needs are being met, especially for mental health services, is also something that research has found. It creates trust and a more open discussion about what will happen in a crisis, and then people feel that they have more control over emergency situations. Next slide. So the benefits of having an online advance directive are that it's easily accessible to your providers and your loved ones, especially in crisis situations. You're going to be learning today, later in this webinar, how to fill out your advance directive and upload the Mental Health Advance Directive online so that your providers and anyone else who needs it can have access to it. It means that because it's integrated with the health exchange system in Maryland, whenever you are in a hospital in Maryland or you're meeting with a provider who have access to the same information, they will be able to go right online and look at your advance directive. You can also make changes to the advance directive anytime that you want because it's online. Next slide. Another part of having an advance directive is identifying a healthcare agent. A healthcare agent is someone who knows your healthcare wishes and can share them with your providers if you're unable to speak for yourself. That person can be your spouse, your cousin, any family member, a coworker, a friend that you've known for a long time. It's really someone who you trust who will advocate for you. In the state of Maryland, they need to be at least 18 years old, and they cannot be your doctor because that would be considered a conflict of interest. So if you had an emergency and the doctors were making decisions for you and you couldn't communicate your wishes, your healthcare agent would be the one who would be advocating for you and make sure that your voice and your preferences are heard and followed. Next. How do you select a healthcare agent? Well, it's recommended that you choose more than one so that you have a backup in case the first one is not available. You may have to have the same or separate healthcare agent for medical and mental health. That is completely up to you, but it certainly can be the same person or it can be two different people. And you want to make sure that they understand your wishes in both types of situations, that they are very clear with the plans that you've laid out in your advance directive for either mental health or medical needs. Some questions to ask a healthcare agent. Are you willing to talk to my doctors to understand the care I'll need? If I'm still sick or not able to speak for myself, are you willing to make decisions based on the wishes in my advanced care plan? Do you understand my mental health condition and the needs that I have? These are really important questions that you want to make sure you ask and get answers that make you feel comfortable and trust that the person you choose is going to follow your preferences and your wishes. Why have both a medical and a mental health advance directive? You may experience a crisis in either one of these situations, and you may want different treatments for a physical health crisis versus a mental health one. What we're going to do now is look at a mental health advance directive form that is available in Maryland, and I'll walk you through it. You will be able to get the link to this document at the websites listed at the end of the webinar. Okay, so here is the Advance Directive for Mental Health Treatment that you can use. Very easy to download, and then you can print it off to fill it out or fill it out online. Page 1 is pretty straightforward. It's the statement of intent. It explains what this is for, that this is a psychiatric advance directive. Once you get to page 2, you begin to add information about medications, side effects, and specific providers. And you see this is sort of an example. We've filled out some of the documents so you can get an idea of what it looks like. Pages 3 and 4 are about types of treatment. This is something that you definitely should review with your provider so that you make the right decisions for yourself. It identifies if you're willing to consent to ECT, to other types of treatment, and even further down, it gives examples of other interventions that you might be willing to follow or things that have worked for you before. Page 5 talks about hospital and provider preferences. So this is where you can list hospitals that you prefer to, be admitted to, or other requests that you might have. Pages 6 and 7 talk about the visitors that you're willing to have come see you and who the treatment team can talk to. This is basically the release of information. And this is definitely where you want to make sure to include your healthcare agent on this list. Page 8 has special requests and needs. It talks about coping skills that have worked for you and other medical issues. Here's a list here of some of the coping skills that you might call out. And page 8 continues with some of that, some other special considerations. And the co-occurring medical issues are also listed there. Page 9 is where you identify your healthcare agent, as you see here, and the healthcare backup. And then page 10 is where you provide your own signature and witnesses to finalize the document. Once you have done all that, you will be ready to upload it to the online system that you're about to learn about. You want to make sure that you review this document with your provider so that you make sure you select the things that are best going to meet your needs in a mental health emergency. I'm now going to turn it over to Sarah to show you how to complete a medical advance care document online and how to upload your completed mental health advance directive as well.
Great. Thank you so much, Carrie, for sharing that important information. My name is Sarah Hofstetter, and I'm the lead project coordinator for the Voice Your Choice program. And today I'm going to show you how to complete a medical advanced care plan online and upload the Mental Health Advance Directive so that it's more accessible in an emergency. First, I'd like to introduce you to the Voice Your Choice program. Voice Your Choice is a community-based advanced care planning program that encourages advanced care planning through education and information for both the community and healthcare providers. Voice Your Choice reaches out to all adults 18 years and older to support them in thinking about and documenting their healthcare wishes. One of the main goals of the program is to assist individuals in choosing and writing down who would speak for them if they cannot speak for themselves during a medical emergency. As mentioned earlier by Carrie, this person is called a healthcare agent. One of the most exciting features of the Voice Your Choice program is access to a free online platform that allows you to create a medical advanced care plan and upload a mental health advance directive so the plans are more accessible in emergency and mobile across sites of care. So if you're ever discharged from a hospital to another site of care, that next site of care will easily be able to access your advanced care plans. This is because the Voice Your Choice online platform is integrated with Maryland's Health Information Exchange system called CRISP. Carrie had mentioned this earlier in the presentation. CRISP allows healthcare providers to be able to access information about new patients before treating them. All of the Voice Your Choice resources and tools are free thanks to the generosity of the Nexus Montgomery Regional Partnership. We need to run through a disclaimer like so many things today. Voice Your Choice is not responsible for offering any medical or legal advice during this webinar. We're also not responsible for any technical malfunctions that happen with the website or the online platform. And we cannot guarantee that your healthcare provider will access or follow your advanced care plan. Now that we've gotten that out of the way, let's turn to learning about online advanced care planning. So as you can see, the online platform allows you again to create your medical advanced care plan and upload your mental health advance directive. Again, access to the site is free and there's never going to be a cost to you to store your advanced care plan. The platform can be accessed through the Voice Your Choice website at www.voiceyourchoice.org, and you see the address at the top of the slide. While on the website, I'll also point out resources that will be useful to you. You'll notice at the top right-hand corner of the website, there is a button that says Complete Your Advanced Care Plan. That's where we'll go shortly to visit the online advanced care planning platform. Before you can complete your online advanced care plan, you're going to need to create a personal account. When you click on the button for the website, you'll see this online platform. You're going to want to click here, New User. When you click New User, you'll be asked for contact information and to create a username. Do not use any nicknames and be sure to use your personal email, not your work email. A confirmation email will be sent to you asking you to confirm your email address. Click on the Continue button here. When you're brought back to the platform, create a password that will protect your account, and that's easy for you to remember. The next time you log on, you're going to click on the returning user because your account has been created. Once you log into the site, be sure to fill out the information on the identification page. Again, no nicknames and be sure to use your personal email address. This information will be used by medical workers to confirm that they have the correct medical information for you. So now let's go ahead and visit the Voice Your Choice website. When we go to the Voice Your Choice website, again, I want to point out the Resources tab. The Resources tab will have information for you under the Community section. And when we go to the Community section, you'll see there's information about advanced care planning. There's the opportunity to take an advanced care planning webinar or review a specialized advanced care planning webinar, such as the webinar today. And of particular interest is the advanced care planning resources. When you click on the advanced care planning resources, a document will come up. And on that document, you'll see in blue, resources for the mental health community. When you click on this first link, that's going to bring you to the document that Carrie walked through earlier today. So let's go ahead and move on to the platform now. Again, we're going to click on the green button at the top right-hand corner. As you can see, when you come to the platform, you can create your own online advanced care plan or upload an existing document. I'm coming in as a returning user because I've already created my account, confirmed it, and have set up my account. When we come to the account, you're going to see the dashboard. The dashboard provides you with an overview of your account. You'll also see that you can upload documents here and here, and then you can also add contacts. The main area that we're going to be on today is the My Decisions tab. The My Decisions tab is where you're going to create your online advanced care plan. We'll show you later how to upload the Mental Health Advance Directive. When you go to the My Decisions tab, you want to click on My Healthcare Agent. This is where you're going to designate and write down your healthcare agent's information. You want to do this because it's important to get that information into the platform, because in 24 hours, that information will be available to the hospitals and healthcare providers. As you're comfortable and you've had a conversation with your healthcare providers and those who are most important to you, fill out the other sections that we're going to go over today. When you fill out the healthcare agent's information, please be sure to be as complete as possible so that they can be easily contacted during an emergency. We recommend, again, that you designate at least one backup that can be your backup in case your primary agent is unavailable. You'll see on each page there's a guide section. Under the guide, there's a glossary that gives you definitions of words you may not be familiar with. There's also a section that has commonly asked questions about each of the pages. So we're going to move on now to the next section called My Advanced Care Goals. On this page, you'll be able to document your values and preferences in priority order. You'll see here, you can click on what's important to you, and then you can move it up and down depending on your priority. If there are things that are important to you that aren't on this list, there's a free text box below. Feel free to go ahead and further personalize your answers with your text in those open text boxes. These open text boxes can be found throughout the platform. You'll also be asked here about if you have a specific religion, spirituality, or belief system that you would like to share with your healthcare providers. They'll also ask you if you'd like to access palliative care at the appropriate time. The next area we're going to go to is My Preferences in Specific Circumstances. This is the area where you're going to document your healthcare treatment preferences if you are unable to speak for yourself. Again, you can choose among the existing options or use that free text box to further personalize your answer. We strongly encourage you to take these questions to your healthcare provider to discuss what kind of treatment would be best for you. The next area we're going to look at is called My End-of-Life Preferences. Under My End-of-Life Preferences, you can select where you'd like to spend your final days. If you have a portable medical order, which in Maryland is called a MOLST form, and if you're not familiar with what that is, you can go to the resource section on the Voice Your Choice website and click on the Advance Care Plan versus MOLST, and it'll give you further information. It also asks if you're interested in being an organ and tissue donor. The final tab that we're going to go to is the My Thoughts tab. And under the My Thoughts tab, you can list preferences that are non-medical. You may like flowers by your bed, or maybe the sound of the ocean, or you like to have your bed face the sunlight. We encourage you to use this page to start a conversation with your loved ones about your advanced care plans and wishes. Under My Circle, you'll see that you have the opportunity to list your contacts, and you can share information to the degree that you're comfortable, from no access to share all documents. Again, be sure that you fill out the area as completely as possible with all the information you have for your contacts. At a minimum, we encourage you to share your advanced care plan information with your healthcare provider and your healthcare agent. The last tab we're going to go to is the My Documents tab. Under this tab, you can see that you can print out your document, you can also preview your document, and you can look at something called the document history. The document history is a chronological listing of all the changes made to your account and the date that those changes occurred. It cannot be altered even by the user. This is an additional protection for your account and can be viewed by healthcare providers in case there are any questions about your online advanced care plan. Let me show you now what a completed document looks like. You'll see the information that you filled out on the online platform is all contained in here. Your personal information, your healthcare agent, your advanced care goals, and your healthcare treatment preferences. Let's go ahead and see what it looks like if a doctor were to pull your advanced care plan from CRISP. Again, it's the information that was on the other document, but much more abbreviated so the doctor can get to the important information very quickly. Your contact information, which they'll compare to make sure, again, that they have the right information for you. The listing of your healthcare agents, any alternates. Here you'll see we listed one of our healthcare providers. You'll see the other areas that you filled out are also here. And importantly, in this red box, you'll see that you have the answers for your healthcare preferences so that a healthcare provider can easily access that. So that's all the information for creating your online advanced care plan. Let's go ahead and look at how we can upload the Mental Health Advance Directive. When you come back to the dashboard, you'll see that there's two areas to add documents, here and here. You'll see we uploaded some sample documents just to give you an idea of what uploading looks like. So I'm going to click on the green button that says Add Documents. When you come to that area and you're adding a document, make sure that you put a title on the document. Then you'll go ahead to select what document this will be. It's going to be under Advanced Statements and Decisions. And then you're going to want to put a date on this. It's important that you date all your documents. Healthcare providers are going to look for the most recent version of any of your documents, and that's the document that's going to be followed. You can see that you can easily add a PDF from your computer, or you can take pictures on your phone and upload it as a picture. If that's it, it's just that simple to upload. So that was a very quick trip through the platform and the uploading. If you want more information, feel free, again, to go to the website and click on one of the pre-recorded webinars about completing your advanced care plan or uploading existing documents. You can also find information under the facts section about commonly asked questions about advanced care planning. You can visit us at www.voiceyourchoice.org. For more information about mental health resources, please visit cornerstonemontgomery.org. Thank you for joining us today. This is the end of the webinar. I hope you found this information useful and will complete your online medical advanced care plan and upload your mental health advance directive and designate your healthcare agent. Thank you for your time.